of New Mexico, United States. He will give us a topic of evaluating the efficacy of micro-fragmented adipose tissue and intra-articular corticosteroid injections for symptomatic knee osteoarthritis, a randomized placebo-controlled study. Please welcome.
Great, thank you. While we're getting the slides pulled up, I just wanted to thank everyone here. It's been a fantastic Congress so far, where we felt very welcome throughout our entire journey. And it's really an honor to be able to be here with this combined meeting today.
Okay. They have some technical problem with this. So you can say something about your talk before you have the slide, if you don't mind, because
no, absolutely.
Yeah, right. Please.
So what I'll be presenting on, so I'm an arthroscopic sports surgeon. I do not do any arthroplasty. I do about a third knee, a third shoulder, and a third hip for my practice. But like a lot of folks, many of us will see plenty of knee arthritis in our practice. So I wanted to look at how can we treat these patients, and are there better options for those patients that fall into the treatment gap, which is essentially those folks who are either too young to have a major orthopedic operation, or maybe they have too many comorbidities or are too sick to have something done.
Right.
Everything including the Kellgren-Lawrence grading for knee arthritis, and your attention on the right side shows that no matter what, with all three groups that we looked at, there was no differences at baseline in demographics. The VAS pain score over the course of the study did not change significantly from placebo in either the MFAT or the steroid group. But as we start to get into the KOOS pain scores and then the function test, this is where we saw more of a significant change, especially at the 6 and 12-month mark. If you look at WOMAC pain score, similar, but I think this next chart showing the total KOOS pain score, so this is difference from baseline. And at 6 and 12 months, significant difference from baseline, but look at the WOMAC function scores and the WOMAC total scores. These are about a 15-point or higher improvements that met the minimal clinical important difference, and you continue to see a positive trend even at 1 year. Similarly, we saw this on the WOMAC total score, that at 1 year it continues with that positive trend, which I think is very interesting for this. So, in conclusion, the MFAT demonstrated consistently positive and statistically significant improvement across all outcome measures, but most importantly in the function scores at the 6 and 12 month. Patients who did have more severe arthritis still did better than placebo and corticosteroid, but they had poor outcomes in all groups. And we didn't come across any complications other than expected pain and ecchymosis at the harvest sites. Major limitation was certainly the blinded sham lipoaspiration that was not performed in this group, but there is an FDA study that was based off of our clinical trial at New Mexico that's now enrolling patients that has double-blinded sham liposuction in that group. Laboratory characterization, so every patient, we obtained a sample of the tissue, and it's currently being evaluated so that we can see what patients can we predict based on other factors. Can we predict who this is going to work best in, and similarly, who it's not going to work good in. So future directions, we're currently looking at our 3 to 5 year study results. Like I noted, the US FDA has a multi-center double-blinded trial going on. And then this is just some of the initial information that we've gotten with our cytokine evaluation. And TGF-beta is very strong in this, and that's a potent regulator of the CD4 cells that allow differentiation and the anti-inflammatory properties. So thank you very much for your attention.